So you all have had a chance to see what great character can accomplish. Visionary philanthropy, great character in innovating in medicine and taking the best care of people who arrive at us asking for help after they've heard those 3 words, you have cancer. What we'd like to do now is something very special, and I invite up to the podium our panelists for the day, and we'll come on up, and we will hear a little bit about what has been in the background of honoring Bill Sharfman today with this professorship, and that is the exploding field of cancer immunology and immunotherapy. I think we've long had hints about how the immune system recognizes cancer cells in the body. What's been changing and changing rapidly is we've begun to understand why the immune system is active or not active, and we've begun to be able to train the immune system more effectively to go chase down cancers and eliminate them, and you've heard some compelling stories about that. This opportunity was so extraordinary that 2 visionary philanthropists, Mike Bloomberg and Sidney Kimmel, invested, as you've heard, along with the Rogers, in the Bloomberg Kimmel Institute. And what we'd like to do is give you just a flavor from our panelists as to what the excitement is about, where the science is going, and how it's really beginning to help people. And I'd like to first turn to our Bloomberg Kimmel Institute director, Drew Pardoll. And Drew, what is the excitement all about? What is happening with the science of immunology and how it's beginning to impact cancer?
I'm going to tell you about how things really work in the Kimmel Cancer Center. So, when the first anti-PD-1 trial started, and Suzanne and Bill really are an amazing team, I will never forget the moment, the first patient that came back that had a regression of their melanoma, and they sent around the scans before and after. I'm, by the way, there weren't any names on them, and I was part of the trial, so that was not a HIPAA violation. I've been involved in trials. We've developed a number of therapies where we've seen one regression, and it was very exciting. And then there were no regressions after that. And this was something that we were plugging away at for actually a quarter of a century. But then there was a second, about a month later, and that's when your heartbeat goes up a little bit. And then there was a third, and we began to realize that we had something special, not only in melanoma, but there was a kidney cancer responder, there was a lung cancer responder. It was getting to be a little bit of a, let's recheck this. There must be a mistake. They sent the wrong CAT scan around. And then there was actually a colon cancer patient who had a complete response. And although the next 10 colon cancer patients didn't have a response. So this PD-1 started getting to be something very, very cool. There was a lot of science that went behind it. And then one day, Luis Diaz comes running into my office with a crazy idea. Now, Luis comes up with about one crazy idea a week.
That's just what he shares with you.
One a day.
That's right. Those are just the ones I know. And he said, the reason that melanomas respond, lung cancers, respond is because they've got lots of mutations. So here's a cancer geneticist, all right, also GI doctor, talking to an immunologist. That never used to happen in oncology, never used to happen. And my first response was another crazy Luis idea. He said, think about it. Lots of mutations, lots of antigens that the immune system can recognize. And then at this, we were also just scratching our heads over why did this one patient with colon cancer respond. Of course, we have the best colon cancer biology and genetics group in the universe. just one floor up. And so we said, we have to do a brainstorming session. And so the immunologists went up. We got together with Bert Vogelstein, Ken Kinsler, Luis, Nick Papadopoulos, and Luis said, maybe this patient is an MSI patient, this specific genetic subset of patients, and characterized by genes that were actually discovered here at Hopkins many years ago by Bert and his colleagues. And we said, I don't know. So we got the blocks of the patient. Lo and behold, it was MSI. So this is a genetic subset of patients, Luis will tell you, have lots of mutations. And then it sort of all started coming together and making sense. And Luis and Bert actually said, okay, we've got to do this trial. They got together with young Lee and sort of formulated this, finally got one of the pharmaceutical companies to actually give us the antibody. And this has turned into, again, one of the sorts of amazing stories that come when you kind of do things the way I described to you, that doesn't actually happen in any other cancer center. So with that, I'm going to hand the ball over to Luis.
Yeah, so next, since I didn't introduce everyone to start, I'm doing the reveal strategy. We have Luis Diaz. So Luis knows a lot about the skin and about skin cancer. As he will tell you, I knew his father when he was here at Johns Hopkins in the Department of Dermatology right around the time that melanoma clinic that Bill Sharfman remembers was launched. Luis, of course, has focused his career, head of the Swim Across America laboratory, on cancer genetics. But as you heard, he was able rapidly to wonder how would cancer epigenetics, or cancer genetics and epigenetics, work with the immune system. Luis, what is happening in the world?
Thanks, Bill. Yeah, so my dad's a dermatologist, and he thought I was crazy when I wanted to go into medicine and oncology. And when I arrived here in 1998, you're surrounded by world-class role models. Physicians like Redonda Miller, who's sitting right here, we were all looking up to as interns and residents here. Then going into oncology, people like Ross Donahauer, David Ettinger, just as role models on how to be as a physician. And across the street were amazing basic scientists, Bert Vogelstein, Carol Greider, Peter Agri, people who were making tremendous impacts on the basic science world. But where Hopkins really differentiates itself, and it's better than anyone else in the world historically, is at translational medicine, is at taking that idea from the basic science laboratories or from clinical observations and applying them clinically. And we're best at the world at that because we have the best patients, community, philanthropy, physicians, nurses, coordinators, and staff. We are better than anyone else at the world at this. So if we're going to cure cancer, it's going to happen here. And that moment hit us about 3 or 4 years ago when that conversation happened between Drew and myself and multiple other people here at the center. And we were able to take this idea that maybe it was the mutational burden that drove the immunotherapeutic response to these checkpoint inhibitors, and that could lead to exceptional responses. And it wasn't just an idea that we were going to shelve in some publication and get some press and maybe some grant funding, but rather it was an idea that was actually going to touch patients. And when I talked to young Lee, who's standing in the back there, about this study, and I pitched ideas to her in the past, and she said no. She said yes to this idea. And we weren't prepared for the impact we'd have with this idea. We had a drug company not fully on board with the idea. They said, we'll donate the drug to you to use in this clinical trial. So we had to lean not on funding from the NIH, but rather from philanthropy. And that's why philanthropy is so important. So we were able to take this idea, create a clinical trial, and then start treating patients. And what we weren't prepared for was not all the attention we got from the scientific community, not the attention we got from the lay press, because we got a lot of it, but rather the impact that we had on patients. And you're going to hear from 2 patients where we had a tremendous impact. And what this idea uncovered was our ability to identify patients who wouldn't be treated with these therapies and probably wouldn't be here today had we not had this opportunity. And Dr. Lee in the back always chastises me for using the word cure, but I am very optimistic that we're going to get here using these genetic signatures. So I'm going to pass it over to Stefanie Joho, who is one of the patients who was on our clinical trial using this genetic marker. This genetic marker, high mutational burden, or in her case, mismatch repair deficiency. We enrolled her in the study, and Dr. Lee and myself treated her, and more than 60% of these patients are having exceptional responses. What does that mean? Tumor disappears, and now 2 years later, they're off drug. Now, mind you, patients at this stage, and she'll tell you a little bit about the story, had no other alternatives. So I'm going to let Stefanie tell you about her story.
So Stefanie Joho, you're a cancer researcher now, as well as a patient, contributing to a clinical trial. Tell us your story. It's really remarkable.
Thank you. Thank you so much. Yeah, so I'm also going to try to keep it brief because we all know how long these stories can get. But essentially, I was diagnosed with an aggressive stage 2B colon cancer at 22. I have something called Lynch syndrome, which many of you probably know, but is a genetic disposition to certain cancers, colon cancer being number one. So I was freshly out of NYU and diagnosed with this aggressive disease. Had surgery, and then essentially 10 months later, that stage 2 turned into stage 4 as my disease metastasized into my abdominal cavity. Another surgery, and then chemo preventatively. As I'm on the chemotherapy, my disease returns once again, and I'm basically put on a more aggressive chemo. So I had basically tried everything that I possibly could at this point at another institution. And I was deemed incurable. I was deemed inoperable. There was nothing left to do. I remember this day, like I remember no other day in my life, but essentially my oncologist in New York basically said, I'm so sorry, there's nothing left that we can do for you. There's interesting work being done in immunotherapy. That was sort of the direction that I was given. At this point, as Dr. Diaz mentioned, I'm barely 100 pounds. I'm taking a prodigious amount of narcotics for my back pain. I'm sleeping 18 to 20 hours a day. I'm not living. Bedridden and just not okay. So essentially what happens is I reach out to my network of doctors, and thankfully my doctor back in Philadelphia puts me in touch with Dr. Diaz. And Dr. Diaz calls me as I'm sitting, waiting to meet with the surgeon who would tell me that he had met with all the top surgeons, and all of them said that I'm completely inoperable and I would have a 2 to 5% chance of making it off of his surgical bed. And Dr. Diaz calls me, and I'm like, Mom, should I answer this call? It's from Baltimore. And she's like, yes, answer the call. And this is the call that forever saved my life, because Dr. Diaz essentially says, get over here as soon as possible. We've been having tremendous success with patients like yourself. And when I tell you that that was a lifeline to me, I'm not exaggerating by any means. I was more than ready to give up. I had the top doctors in the world telling me that it was time to give up, and Dr. Diaz said, no, get over here. And that was the light that I needed in the darkest of days. So I get over here, and the rest is history. Within 3 days of my first treatment, I started to feel some relief in my back. Within 3 months, my tumor shrank by 65%. Within, I think it was like a year and a couple months, I was deemed NED, no evidence of disease. And it's been tremendous. I mean, what can I even say? I have my life back. I feel like a human being again. I was on the brink of death, and now I'm here. And the amount of gratitude, how do you give back, right? As I'm sure Mary Jo asked herself this question many years ago. I'm ineffably grateful to this institution. Dr. Lee and Dr. Diaz, I joke they're like mom and dad, because she's the really rigid and incredible. No, she. Well, the funny thing is, I have a Brazilian mother and a Swiss father, so it's funny because you're like the Latin dad, who's like really excited about everything. No, but seriously, they have been incredible, holding my hand through every step of this process. always available for absolutely anything at any hour of the day. This obviously is uncharted territory for everybody, and I could not feel more, I couldn't ask for better people to sort of navigate me through this uncharted and this unknown, and I just would really love to thank also, sorry, I know this is not about me, but I would love to thank Mr. and Mrs. Kimmel and everybody here, Mary Jo and Mr. Rogers, for everything, because I literally would not be here. And thank you for investing in an institution that actually cares about treating human beings and not just numbers. So thank you very much.
I see young Lee in the back, and I realize that very tough with high standards. Paul Rothman was jotting down notes. That's an emerging leader for Johns Hopkins. So John Ryan has had also an experience facing cancer, working with Julie Bramer, one of our great lung cancer physicians, also helping to build this new field of immunotherapy. John, your story.
I was told if I went last, I wouldn't have to say anything because the time would be up. So thank you. I was almost dead 3 years ago. In April of 2013, I was diagnosed with stage 4 adenocarcinoma, non-small cell lung cancer. Went through 4 very painful and unsuccessful cycles of chemo, and having done Foundation 1 analysis of my mutations that weren't there, and a second opinion from William Powell at Vanderbilt, he said, when chemo doesn't work, get to Johns Hopkins, and get to immunotherapy, and get to Julie Bramer. I was crawling in here in pain, bleeding, and in bad shape. When I saw this Sidney Kimmel Comprehensive Cancer Center, I said, who is this guy that buys hope? When I started peeking through the Progress and Promise magazines, I said, who are these people that work for generations to make hope happen? It's real. It's appreciated. My message to Julie Bramer was real easy. Please help me. It was a naval officer, SOS equivalent. She looked at me thinking, oh my God. Well, I'm happy to announce that after 4 cycles of immunotherapy, chasing after that bad boy, PD-1, the anti-PD-1 shrunk my tumor 65% at the Christmas of 2013. Most important to me was the collaboration that Johns Hopkins and Julie Bramer had to allow healing and freezing of my airways and radiation treatment to zap my tumor with an extra dose of radiation for the abscopal effect to put me on the fast track for the immunotherapy to work. I start my 4th year on an extended clinical trial of anti-PD-1. The commercial that you see at the nightly news, who wants to live longer? Well, yeah. But please be advised, as you take this stuff, it may attack your organs while you're on it or after you get off of it. So I asked Dr. Bramer, hey, what's going down here? She says, listen very carefully. The longer you're on this, the less likely you will have disease progression. I said, we're on this. I can't thank enough, I can't be grateful enough for what is available here to Johns Hopkins. The generosity of Sidney Kimmel, the dedication of Dr. Pardoll, his wife, Julie Bramer, and others, the dedication, the culture in Johns Hopkins with the white coats and the blue clad and the green clad, everyone bringing the A game every day to make this the best quality of medical care ever is huge. I will end the story with a thank you. For 2014, thank you. For 2015, thank you. For 2016, thank you.
So a final thought from Bill Sharfman. Bill, you are the Mary Jo Rogers Professor because you know more about melanoma than anyone in the world. How is this new treatments, how do they look to you? You've seen a lot of melanoma in your life.
Well, I'm not sure I know more than anyone else in the world, but the melanoma clinic is a much happier place than it used to be. And it's more exciting, more fun to be in the clinic, and we've gone from, in 5 years, gone from helping 5% of patients with advanced melanoma to helping 40% of patients with advanced melanoma. When we combine 2 immunotherapy drugs together, we probably help 60% of patients with melanoma. And not just help them by a few days or a few months, but give them these long remissions. But every day in the clinic, difficulties come up with the real patients, and these are issues that we at the Bloomberg Kimmel Institute have to think together about how to deal with them. The drugs are toxic. How do we lower the toxicity? Can we shorten treatment times? Can we figure out which patients really need combinations of drugs? Should we give targeted therapy and immunotherapy together? And how do we treat patients with brain involvement? All very difficult problems. The problems come up every day in our clinic, and problems we're going to have to work on. To me, the most exciting thing is the combinations of immunotherapies that are out there, that the potential ones. Right now we have trials with things called LAG-3 and anti-cure, but there's so many potential immune therapies to try, so many thousands of combinations and that have the potential to put people in long remission and with less toxicity. And we're going to need the collaboration of everybody at Bloomberg Kimmel to figure out an intelligent way to test all these important drugs so we get them to patients quickly. And we have to figure out why some patients just don't respond to our immunotherapy. It's very frustrating when somebody does and somebody just doesn't. So a lot of important issues come up every day, and I look forward to being part of this effort to find the answers in the next 10 and 15 years. Thank you.
I'd like to thank all the panelists, and please stay seated. This is a very special time in the conquest of cancer, as you're hearing. And it's also a very special day. We pause to honor Bill Sharfman, Brian and Mary Jo Rogers, and on very special days, we're joined by Sidney Kimmel. Sidney, come up and give us some thoughts.
Thank all of you for being here today. I'm very touched by John's speech. I appreciate every word you said. Thanks to Ron and Paul, who have left for a meeting. I want to thank all the panel participants for sharing their expertise with all of us. Now, forgive me, but after listening to this discussion, I could not help making the analogy between where we find ourselves with immunotherapy today and the early days of my business at Jones, New York. While I had been in the apparel business for more than 12 years when I started Jones, design and production innovation was required every day, every season, to achieve success and ultimately take Jones public. We were always searching for the right mix of fabrics, the best buttons, the perfect fit, and the other logistics to distinguish ourselves from our competitors and have a long-term impact in the industry. Likewise, here at Hopkins, it has taken many years, perhaps thousands of years, when you consider all the human effort of innovation and discoveries in the labs and clinics just to reach this moment when we can now go public. With immunotherapy, the future will be very different and exciting at a higher plane. Inevitably, there will be setbacks, but continuing the type of work that has already separated Hopkins from the rest and holding on to the long view will lead to great success. Sometimes ventures like ours, and forgive me, Jones, and immunotherapy can seem like a gamble. I had to take many risks before and after going public, and it was the willingness and capacity to take those risks that became the foundation of my company's success. Just like with Jones, you are encountering a new set of risks, but I know you take them with wisdom and the vision of a big payoff. I'm behind you now and for the long run. I want to congratulate and thank the Rogers family for their commitment to this cancer center in establishing the first named professorship in the Bloomberg Kimmel Institute. Your leadership is exemplary. Lastly, let me please make one other comment. I know that Terry Langbaum will be leaving the center in the next few weeks. I think she's here today. Raise your hand, Terry, if you're here. The Kimmel Cancer Center will not be the same without her here. Terry has been a friend to Caroline and me since our first connection to the Cancer Center more than 15 years ago. Terry, we wish you great happiness in your new endeavors, and we won't miss you because we intend to keep in touch. Thank all of you very much. I'm very touched by this meeting today.
Well, in closing, I'd like to offer a final congratulations to Bill Sharfman, a profound thanks to Brian and Mary Jo Rogers, chronic indebted thankfulness to Sidney and Caroline Kimmel, and a very special thank you to all of us for joining us here today. Please join us at the back for a reception and good fellowship. This is a great day. Thank you.